Okay. Well, I'd like to call the Fitch-Rona EMS meeting to order at 7:05 on September 17th. We do a roll call.
Sure, I can do that. Can you guys hear me?
Sure.
Yes.
Okay, good. I had to switch computers. My work computer said it didn't have a microphone.
Yeah.
So,
Something to make it work, I guess.
right. So here we go. James Roberts,
Here.
Strassman, Hilla, Johnson,
Here.
Cronin,
Present.
Miller, Durst, Schnapp,
He's there.
Luganbull,
Yep.
Anderson.
Yep.
I think I got everybody.
Okay, I have a connection problem because I buzzed out for a little while, so we had a quorum, I take it.
Yep. And looks like Connie just joined us.
Okay.
Yeah.
Thank you.
Okay, great.
Did we have any public comments?
Just a lot from Mike about technology, but beyond that, I don't know that was anything constructive.
Well, let's move on to review and approval of the meeting minutes from July 16th. Were there any corrections?
I read them and they looked good, but I wasn't at the July meeting, so I'm not sure if I'm able to pass them or make a motion to pass.
I believe they were good. I'll make a motion that we pass them.
Is there a
Is
second?
it Derek? Derek will second.
Okay, all in favor?
Aye.
Raise your hand. Aye. Any opposed? Hearing none, the minutes from the July 16th meeting are approved. We can move on to the chief's report. Patrick?
You think you're a nurse or something?
Let me see if I can pull it over to the right screen. Can you see up? Can you see that? Chief's report?
Yep.
I'm fine.
Yep.
I can look at it.
All right. So this this is what mostly the data that got emailed out to you is the same. There was just, I missed a couple of months, got screwed up as far as titles or so. So here's our chief's report again for September, and that takes us through the end of August. August was another, as I tell you every month, right? It's a roller coaster of an EMS business. Middle of the month, we were way down. The last week of August was a pretty crazy week for the service, and we actually ended up at 311 calls for August.
Wow.
In the middle of the month, we were down. We'll see what happens this month. As of yesterday, we were actually running the whole county is actually pretty low, but as of yesterday, I think we were only at about 150 calls for our month, which is pretty low for us. But we'll see what happens. So that puts us still at a 6% above for the year, still looking at that 3,600 number, which we thought we'd hit for the end of the year. Narcan responses are pretty regular, CAR 15 responses as well. Just the regular data, our monthly runs by municipalities right where we expected to be. Still hovering around that 9 to 10 calls a day. We did completed our consortium training last week and this week, so it's all good mental status. For our run review, Dr. Mansera came on Tuesday. We've actually had some pretty sick patients with allergic reactions over the last month or so, really significant, requiring some pretty intensive care. Both of those patients actually have reached back out to thank our crews personally. So it was a really big deal for them, which it was. And then we have done some online training with OB, and then we actually worked with our UW consortium members. They have a birthing mannequin, a birthing simulator that just does everything. So they actually came 3 days, the first 2 weeks. It was like a Friday, a Tuesday, and a Thursday. We rotated our crews through there and actually spent about half hour, 45 minutes doing some simulated abnormal births, a breech birth, a limb presentation, some weird stuff that, knock on wood, we hopefully don't ever have to do, but some good practice actually having to do that on a mannequin. So that was actually some really good trainings we got from our crew this month. Our usual calls by day of the week, hours of the day, pretty pretty right where they need to be. Calls by municipalities, same thing. Seeing some more flip-flopping in our calls for service there. Our sick person in Falls, still just going back and forth. Traffic incidents back up for the summer, so that's kind of be to expected. Calls by station for August, again, pretty split. That station number 2 in Fitchburg still tends to be the busiest, though Verona's slowly catching up. Where our financials are, everything is within our goals. I did reach out, there's some reporting hiccups as far towards when we get towards the end there, that 151 to 180 days, that presents some weird reports from our billing agency. And I kind of reached back out to Brad, really just to clean some of those reports up. But what you see there, everything is where it should be. As far as our checking and savings account go, what you just see is the checking and money market, that decrease is essentially going to be payroll. Savings account went down, went up from last year. That would have just been a donation that you'll see here later we received this month. And then we made a whole $17 in interest on our retirement fund. Right. We haven't spent anything with our ambulance purchase, our FAP funds, our bike grant, and our CARES Act. That's still waiting to hear our ventilators. I reached back out. We should be getting those probably in October. We are looking, Ryan Dockery, who's kind of leads our bike medic program, looking at probably adding a 3rd bike next year to our bike medic program, one that's actually a little bit bigger for some of our bigger, taller bike wheels, for our taller medics to actually ride. That'll take care of a lot of that. And then he's actually been doing some research on upgrading those bikes to e-bikes. So kind of looking at what's going on at the Alliant Energy Center, maybe reaching back out to Epic again to see to upgrade those to e-bikes. So that's kind of something looking at in the future. And then you'll see our funds sitting there as well. There's that $17. As far as donations, like I said, we got a $500 donation from a patient who was very grateful for our care. And then Hy-Vee actually brought us and I think up in Fitchburg and down in Verona, brought about a dozen pizzas, frozen pizzas, the Hy-Vee pizzas. So a big thank you to them. And then we only had one milestone in September, and that's Brandon Ryan, who hit 11 years with us. He's one of our full-timers. Comparables are there. That's what I have for that report.
Patrick,
Yes, Mike.
have you spent all your CARES money then on the ventilators?
I have earmarked it for the ventilators. We actually don't pay for them until we get them.
Okay, because last night I was at a meeting and they were saying, take the town, we don't spend all our money. We can either buy something for you for this, or we can give you the money so you can buy something.
Who do you want me to reach out to that? Because I don't entirely believe that.
Well, this was the lawyer from the Towns Association, State Towns Association was talking about this, and he goes, yes. And they were looking at trying to put it into broadband. And they go, oh, I don't think you can say where you want the money to go if you give it back to the county or state, because that's what will happen to the money that we don't use is going to go back to the county or state.
Sure.
And but if there's some other wish list thing you might have out there, it's worth pursuing. I don't know if there's anything.
Did you talk about Pappers at one time?
Yeah. So and how it works. So we got, it's a little bit different if that happens in the municipalities. That happened with essentially the healthcare CARES funds. Right. So most of the municipalities, you have to ask for the funds. Healthcare agencies, which is EMS agencies, we were given the money. Essentially, it was given to us, and you said you had to say, "I'll keep it," or you had to actively say, "I'm going to give it back." If you kept it and even didn't say anything, you kept it. The assumption was you were going to keep it versus giving it back. And we talked about this a while ago with kind of some restrictions on it.
So you're gonna say you could only buy certain things, right?
Yep.
Yeah, it has to be COVID related.
Yeah.
The Department of Health, Wisconsin DHS, also will provide it. It's very similar, only that was you had to request the funds. I actually proceeded with filling out the application, got all the way to filling it out. And one of the things it said was, how much have you already received from other agencies? And I said, well, we got this big old chunk from already. And they said, so we will give you whatever you spent minus what you've already received from other agencies. I haven't spent that $24,000 yet because I don't have my ventilators yet, which means I can't ask for more money because I still have the money. The other part of it is there was only the maximum an EMS agency could receive was about $1,250. So that is probably what we've spent so far in foggers, in additional cleaning supplies, in, we have shower curtains, we have some more PPE, but that's really about it. I mean, we have not gone crazy overboard. We've gotten what works. So I have not gotten any other funding kind of because of some of those challenges. I can definitely, would Sarah be the person to reach out for that?
Sarah or Teresa, but I don't even know if they know about it because I just found out about it last night.
Okay,
So I will get in touch with those two tomorrow and tell
Okay.
them, this is what I was told.
okay,
And I don't know where we are in our spending, but it's not close to anything that we've spent.
sure.
I'm
Because
gonna
one of
say,
the other challenges, like the city of Fitchburg and city of Verona got it as well and did expenditures and asked for the reimbursements as well. And nobody really knew there was a clear line because Fitch-Rona is Fitch-Rona. Fitch-Rona is not a city or town entity, and it kind of, as far as not being clearly understanding the law of that gray line of, can I ask for stuff from an entity that I don't really belong to? Or, I don't know if so the town to buy something for somebody else, I don't know how that works. Or if the city of Verona bought me something, can they really only pay for 45% of it? So we
what they said last night, people were barraging them with questions. And what they said
sure.
last night was, if you, Fitch-Rona, is our area's paramedic service, and they brought in some, say you don't even have your own local paramedic service and you hire in a Ryan's to be your paramedic service. You, Town of Verona, if Ryan's was our service, we could turn around and buy something for Ryan's
Okay,
if it met all the criteria.
okay,
So that's what they were saying last night.
okay. We've absolutely spent some funds on COVID stuff that have not been a reimbursable item because I still have the hiccup there with the money I haven't spent yet. Why don't I connect with Sarah?
Okay, yeah, you try with her. Try getting a hold of her. I'll try getting a hold of her and
Okay,
Teresa and let them know that you're coming. But
okay,
I'll let them know what was said, and then we can, because you got to get all this stuff done.
Yeah, by
You're running out of time. I think it's November.
yeah,
end of October.
October, I
But
think,
so
yeah.
Mhm.
we will have a board meeting. We're getting a purification thing in the town hall, I think. We got some laptops and iPads coming.
Okay. I'll reach out to her and put some stuff together. One of the biggest things, and it's not going to go away, is the cost of medical supplies. And the only number I really know is a case of gloves for me 6 months ago was $96. About 6 weeks ago, a case of gloves for me is $146. They went up $50 a case in the last 2 months.
So Patrick, on those gloves, do you use the same gloves around the buildings to clean as you do out on a run?
That is funny that you brought that up because actually just yesterday, as I was walking through the kitchen and I saw a box of gloves in the kitchen, I actually had a conversation with the fire chiefs today and said, that can't happen. I will go get vinyl kitchen gloves for you to clean the station with.
Okay. The only reason I ask is the ones we ordered some, they just haven't come in, to donate.
Okay.
And I'm not sure the quality. You can't tell the quality by looking
Yeah.
at a picture sometime.
Yeah. We currently do. I am trying to change that practice. I don't know the cost of a vinyl glove versus a nitrile glove, but I gotta believe it's significantly different.
Yeah. Okay.
Absolutely. If you're the school district, way back in March, when they donated some masks, they actually donated some vinyl gloves that were kitchen gloves because the kitchens were shut down. We
Mhm.
used those for cleaning.
Which,
So yeah,
there's no reason why you can't. Yeah.
absolutely. Yeah, we absolutely cannot use them for patients, as you're
Mhm.
very aware.
Yep.
But we can use them for disinfecting the ambulance and cleaning our station.
Perfect.
To clean
Well,
up
we
that
have some
station.
coming your way eventually if they ever get here.
Sure. My guess is the demand for all gloves is pretty high.
Hmm.
Fortunately, at least we can still get them. So as much as I whine and complain about the price, we used to get them in 2 days. I get them now in about 2 weeks, but I'm still getting them. So
Yep.
we're still getting what we need.
Stock up. We got another phase coming.
Yeah, that supply system that we invested heavily in that got us down to a lot of just-in-time ordering. And I don't think ever would have predicted this. We have had to change a lot of those numbers back to what we used to have of cases of gloves in the shelves. And we said, why do we need cases of gloves in the shelves? And now we know why.
Yep.
Pat,
Yes, sir.
I take it the ventilators are ordered. Is there any estimation on delivery?
Last I reached out to him he said the end of September or October.
Yeah, we haven't gotten ours at the hospital either.
Yeah, which I kind of knew. I was really surprised. I mean, I'm figuring October. I'm hoping October. We are all set up to go with training once we get them, and they'll come with some supplies. Yeah. So they're on their way, hopefully. The other, I don't know that I took any other notes here with the chief's report. Our response car that we're supposed to get in April will be delivered on Monday, car 17.
Ooh.
So that'll come on Monday, and then it'll go up to Gen Com and the graphics shop for the following 2 weeks. So hopefully by the middle to end of October, we'll actually have our second response car in service.
Cool.
Good.
Yeah, that's exciting. We've been waiting for that for a couple of years now, so it's nice.
How many miles are on the other one?
We just turned it over to 38,000.
Wow, low miles.
That's all.
10 years old.
Yeah.
Although I'll say the first, Cindy and Brian didn't use it, so the first 6 of those 10 years, I think it had 12,000, and Jeff and I have managed to put 18 on it in the last 5. So it's still,
A lot more use out of it.
it's still going to be a low mileage vehicle, but we're putting miles on it. As far as the bright and beautiful financial stuff that you see that's our current in-house reporting. As I kind of tell you every month, I'm still not sure why I'm working with our billing company. That run income is down. I did share a little bit last month as I went back and looked. That third station, I think, is playing a factor into some of this of where we get a lot of calls now because we're closer to a lot of areas and we get turned around a lot. So that messes with the formula that Lon had for decades and decades that said, when we have 3,000 calls, 3,600 calls, 15% of them are no transports and don't generate bills. We're now upwards of probably 25 to 30% of those calls we get are no transports and don't generate bills. So I need to go back and tweak that number. I did a little bit for this year. It was significant, very significant. So I'm going to tweak it next year again as well to be a little bit more accurate. So that run income expectation is more accurate. We've gotten all of our municipality money. We're still not teaching CPR classes. So the only event we did was we did a standby out back a couple months ago out at the horse show. You won't see. So we did actually do our event at the Alliant Energy Center on Labor Day weekend. We had 2 bike medic crew and an ambulance crew and Jeff out there for 4 hours. Yay, no issues that night. So you'll actually see that money coming in here next month. That invoice was sent out. Other stuff you'll see there, we're actually sitting pretty good on with our wages. Our scheduled overtime is a little bit higher. Well, our unscheduled overtime, I should think it's just a tweak. We need to make sure that I think we're putting things in the wrong spot, but I gotta go back and double check. I don't know why that one panned out that way. We do have 1 employee out on a work-related injury. I think I reported that last month. That person is still out this month. I'm hoping as of last assessment, they'll be back at the end of this month. So otherwise we're actually doing kind of okay on that. Terry did bring up the medical director fee. And I just wanted to share that one with you, why it's 125% when that's a fixed cost. Our consortium actually screwed up the billing cycle is what they did. We didn't note it. They did not bill us for the last quarter of 2019. And we actually didn't notice that they didn't bill us for that until, Michelle, was it April? It was fairly late.
It was.
Big tag was it was after the audit. So we owed the money, we had to go back and pay them, but because it was after the audit, we just left it in the 2020 budget or the 2020 line item. So that's why you see it at 125%.
Right.
It includes fourth quarter of last year, which we didn't pay, so the money was there. But that's why it's at 125%.
Okay, thanks.
Other just crazy stuff. I said we talked about personnel recruitment. That's just, we brought on some LTEs that was kind of unexpected. That's why I kind of increased that line item for last year. It's a little, by the time we bring them on and get uniforms for them, it starts to add up a little bit. Otherwise, nothing, no other crazy stuff. The medical equipment maintenance is a little, medical equipment is a little bit higher. That was the purchase of a stair chair. And kind of as I've mentioned, you know, when our stuff breaks, it breaks big. So we've actually had, I think it was a pulse oximeter or a CO monitor that we've actually had to replace as well. So it's still not a gigantic but overall, you'll see our total expenses are at 63% for the year, and we're at 66% through the year. So we're actually, right. Though run income is down, our expenses are also down about as much. So overall, we're actually sitting pretty good. Any other questions on finances?
Okay,
Perfect. What do we got next?
okay. That's it, Patrick? Should we move on to Chair's report? I assume the personnel or finance meet? I'm assuming not.
No.
And let's move on to review and approval of accounts payable, which we
Fine.
had quite a bit to look at.
Yeah, I totally forgot to copy that one and bring it with me, but that did get all emailed to you.
Yep.
Not something I necessarily want to display for the public.
24 pages.
I make a motion to pass. I didn't have any questions. I mean,
I'll second it.
All in favor?
right?
Say aye.
Aye.
Anybody opposed? Hearing none, the check detail from January through August 2020 is approved.
Perfect. Thank you. Again, I'll start putting that on our monthly or however often we meet. That's something I don't like to throw up for the whole TV
Oh, we're
world to see.
hoping.
We're writing checks on, so
Checks.
I've kind of been delaying that and hoping we were going to get back together. And
Yeah, that would be a
Like we're
while
going to.
before we get back together.
yeah, so I'll just continue to email it like that. Please let me know. I think Mike reached out when he had a couple questions on it, but I explained them. So if you see anything, just let me know.
Okay, thank you. Did you want to talk about the check signing authority, or do you want to?
So I think we're going to have to skip over that because I don't want to volunteer Shannon for something she's not going to do.
Okay, we'll put that on for next month then.
Yes.
Oh, she doesn't know it yet or wasn't asked yet?
Well, I did ask her. I've emailed her. I have not
Oh.
heard back from her. So what we need is an official, just essentially an official meeting, something that says we're taking Janelle off when she left the city council back in April, and we would be putting Shannon on there. I am truly we have, again, myself and Kate, thank you, Kate, for signing 99% of the checks, and Mike for the other 1% when we give you a call. To me, that is plenty. I think it's just been past practice to have one from every municipality, and that was usually the sitting member. So we just had it Shannon, we had it Janelle. It doesn't have to be. That's the discussion. So honestly, we don't need it. I just put it on there as a matter of fact.
We can wait till you get this talk. I think,
Sure.
right? Okay.
Sure. Yep.
You want to talk about the ambulance charges policy then?
Yep. Let me pull up the right one. I don't know if everybody noticed I sent you the wrong one today and I resent the correct one.
Yeah.
So one of the things was the driver, and I think we looked at this not too long ago, but one of the drivers of this is I finally got around to it's been on my list of things to do for about 2 years. We had somebody from Dane County, Lilani, is her name. She actually works for Dane County in the Department of Aging, but works a lot with the elderly patients on financial support. It's been in my email box for 2 years. She came and did a presentation at one of our EMS associations about firming up your financial hardship policies. And I just finally dug it out of my emails. I'm like, all right, I got to get this done. So as long as I was in here, I went and tackled the whole policy itself. So most of the stuff you see in the big changes are truly formatting stuff. And then we'll talk about the hardship part of it at the end of it. And that's really what I'm looking for your guidance or support on. And then I told her I would send this back to her to take a look at it. It's kind of her history. So what you just see.
Your first paragraph, are there 4 service categories, not 3?
So it would be base rate. Well, it's I could change it to 4 because I just added standby in there.
Service categories. It was just a little confusing to me because there's 4 things in there.
Yeah, that makes sense. So yeah, it would be, and all I did then was separate them out because the original policy just had the formatting was bizarre on it anyway. So I fixed some of the formatting, but it really just described base rate. I'm like, well, so let's call them what they are. So it really just defined what those 4 different categories are, as well as explained what a standby was. And I don't believe a standby pay was in there at all to begin with. It talks about intercept charges. That's kind of a county-wide approach. I did the old policy said right way back when we were a volunteer agency that volunteers paid staff, and I was unaware about commission members not being charged for services. I don't think you can do that. I think that, right, as much as I'd love to get your vote on things, I think this is probably not the appropriate way to get your vote and support on things. So I actually removed that line item in there. So it truly is volunteer paid and paid staff in good standing. We would still, if it's work related, again, this policy comes from something 30, 40 years old. If it's work related, workers' comp will pay for it. And if it's perchance an employee is leaving work and gets involved in a car accident, we will still bill their insurance. Just any liability that the volunteer, right, the Tom, or any liability that the employee would personally have gets written off. So that's what that one actually says. And then we took commission members out of there, so you're gonna have to pay should we come to your house. Sorry. And then it talked about immediate family members. Again, this is an old policy. I took that out of there.
Yeah.
Fixing some capitalization. I have not changed anything with the transport fee other than there was a will be charged. I changed that to give a little bit more wiggle room in there. It says may be charged. That one comes from, which we have and occasionally rears its ugly head about some healthcare facilities. I've shared it in the past. The challenge with senior housing or seniors living in there is a senior in senior housing must be able to take care of themselves, i.e. if they fall, they must be able to get themselves off the floor. If they can't, that's assisted living, and that's different. So there are some facilities, and I don't want to call it abuse, it just walks this very fine line of we get called to some places and there's staff standing there who says, I can't pick them up off the floor, because that person now potentially will get kicked out of their housing because they need to go to assisted living, not senior housing.
So it's not nursing homes. I was thinking nursing homes and things like that.
It tends not to be nursing homes, though that has been an issue in the past. That has gotten a lot better. It's usually more of senior housing, and it's usually assisted living is what it is.
Okay.
But there's potential for abuse there about getting called back and back when, I mean, they have competent staff there who you really just need to pick my mother up off the floor, right? We get really frustrated at that.
Are there legal implications to us knowing that we're there to do that? I mean, there's no duty to report or.
we work, if it gets into situations like this, we try to work with those facilities, the senior center and those patients to get, in the best interest of patients, to get them where they need to be.
The help that they need, right?
Yeah, and most of like a senior housing will have people in the resident, there's people still there, right? Distributing medications to some patients, sometimes doing cleaning, sometimes cooking. So we can assist some of those times. A lot of times it's the directors of those facilities who have to reach out to family members and say, your family can't stay here, right? They need more help than we can provide. Sometimes it's changing the stick. They stay in the same apartment and they just change the sticker, and now you're assisted living, you're not residential facility, and now we're going to charge Medicare twice as much for you to live here.
Yeah, but it's just safer for the patient.
Absolutely. Yeah, absolutely. But that's why I changed the wording in there from will be charged to a may be charged, because I like the wiggle room of sometimes it's complicated. And there's some guidance in there that says we start, again, these situations get really complicated because it talks about, starting to bill facilities. Facilities are just going to roll those costs over to patients. So that doesn't help anybody. But there's some guidance in here about what to do. I added law enforcement when responding to a fire or a law enforcement standby, and no patient contact is made. We don't charge the fire department. We don't charge the police department. Couple of just fixing things. When we do Medicare medical assistant, it says we write stuff off. That's required by law. We don't willy-nilly write stuff off just because it's Medicare medical assistant. Same thing, workers' comp. I don't know why it's green. I think it's just moving things around. So the blue stuff is all new stuff. And I apologize. I don't know if anybody is out there red-blue colorblind. You're not going to be able to see any of this, and I apologize. Shoot me a text afterwards so that I never commit this sin again. So we really didn't have a solid write-off policy before. This one is more robust. Adopted a lot of what the city of Madison has already done and a lot of other agencies. Jeff actually went out and did a lot of research as well to what other agencies are doing. And I don't know, did you get this today, Derek, or have a chance to look at it now that you can't see it?
I did get a chance to look at it, yeah.
Okay, so you at least have an idea what we're talking about. So yeah, Jeff did some digging around. This matches a lot of what most other fire and EMS or fire-based EMS agencies do, and matches what the city of Madison does. So it still defines it that it's a case-by-case basis. We don't make these blanket statements of like, all right, I'm fine, I'm just gonna write this off. What it does is it has creates a form that a patient, we would send them to our website. They create a form that says, I am in financial hardship. The intent is actually to put this out in multiple languages, at least English and Spanish, because that is our primary patient population, or the primary requests that we get. So we'll post it on our website in at least 2 languages, English and Spanish. What they would have to provide is fill out the form and then provide, and this is where it gets a little kind of dancing around they do have to provide proof of a tax return, essentially, that they filed a tax return in the past. So, or a pay stub, so like a year-to-date pay stub. Based on that pay stub, and then we just have to hope, essentially, for honesty in that form. They'll fill out, here's my pay stub, here's my tax return, and X amount of people live in my home. That actually puts together and works on a beautiful graph to the link there for the National Poverty Guidelines. I didn't include the chart in here because those National Poverty Guidelines change every year, and I don't want to have to change this policy every year. So it provides the link to the National Guidelines. So based on what they provide us, we look at that chart and say you either are or are not met below the level of the National Poverty Guidelines. It does in here that it is based on every single call. So it's not a blanket person on Main Street. It just kind of gets this forever and ever. We're going to either reduce or write off your account. Every time you get called with your place, you have to prove to us that you're still in a financial hardship. essentially the spirit behind Lilani, and I can actually have her come talk to us if you're very interested, really is taking the approach of, again, she works with people who are in financial hardships that, though as much as we want, money as a municipality, most of these patients, they truly are living paycheck to paycheck, or they're sending money back home to wherever they're coming from. And us, for $1,200, right? I really want most bills now are up to about $1,500 for just our EMS bill to literally put you in my ambulance and drive you to St. Mary's and not even touch you is about $1,500. That they are truly in those financial states of us sending them to, they're trying to get into a house, they're trying to pay for their kids, us sending them to a collection agency, now earmarking their credit forever and ever, that they haven't paid their ambulance bill. We are essentially contributing to the cycle of a rock that they're never going to get out of. So her approach was,
Nice.
help stimulate the community that you serve and write these off, or reduce them or write them off. So there's two different approaches. What you see there is that graph, that percentage of poverty, people in their household and the percentage of poverty. This is what the city of Madison uses. So based on, you're at 100% of the poverty level, you get 100% of your bill written off. If you're at 50% of that poverty level and you only had 2 people in your household, we reduce your bill by 80%. It reduces it by 40. It reduces it by 20. Now, I don't know how many of you caught the same question I have. I have no idea where this chart came from. When I presented it to her, she said the same thing to me. I have these to me are truly arbitrary percentages. They match nothing. Kind of the guidance I got from her, she said, make your life easy. It's all or nothing. If you meet the national poverty levels, we write your bill off. The other option we have, which I have actually done with some patients in the past, is if they write and they're like, I can't pay this bill, can you reduce it? I work with our billing company and I reach out to Brad and say, what would medical assistants have paid? Out of $1,500 bill, medical assistants usually would pay $200. So what I usually will then is take the $1,500 bill and reduce it to $200. That's kind of what I have done. Now, if there's patients who say, I cannot pay this bill, right? I am unemployed, I lost my job, I'm supporting 3 kids and I'm sending half my paycheck home to my parents and wherever, those patients, I usually reduce it to 0. So I guess we have a couple options, and this is why I put it on here to ask you about kind of what your thoughts were. And we can discuss it.
My thoughts coming from, I mean, I work with the state in a hospital situation, and just making sure whatever that we do it consistently and we do it fair. I don't know how you can, unless you document it well, that you charge somebody $200 and somebody $1,000 something, just so that this process that we have is consistent and fair to, and follow the best we can.
Yeah, absolutely. And I think that I was leaning more toward, so okay, fine, you meet 80% of the poverty level, so I'm going to reduce it to $200. But then I come back to, there are some people with $200, even if it's $10 a month for the next 20 months, it is still
a hardship. Yeah.
So I very much lean towards, if you meet national poverty levels, we write your bill off. But of course, as that comes out of my mouth and I go back to 15 minutes ago and tell you that run income is very down, and that's going to have to be made up by taxpayer dollars eventually, trying to walk the road. So we did provide a service. Any other thoughts or discussions?
Yeah, well, you're using last year's income then, right?
Correct. They would have to prove financial income, which may also present its own problem, but that one I don't have a better system.
What if they became unemployed this year?
What's that?
What if they became unemployed this year? So they have no income. So they would be
last year's income.
Yeah, and that is something I can reach out to Lilani and say, how do you manage that, or how do you deal with that? The city of Madison truly says you need to provide us with your less.
I mean, that could get covered under your first one where payment plan could be arranged to a review of circumstances. They could have lost their job because of the COVID-19.
COVID, right, exactly.
Sure.
This year's a good example.
Sure.
Well, and are there people who make so little that they don't even have to file taxes? So what is the documentation for that if they can't provide a tax return?
Sure. And these are all things this is that fine line of I'm not sure how do I verify financial information? And these are questions I can go back and ask Lilani and say, how do you do this at the county level? Because absolutely agreed. I often hear that, right? Not a lot, but I guess frequently, when we pick people up, it's because of my injury, because I even called the ambulance and my injury at work, I lost my job.
Right.
Or I am temporarily unable to go back to work. I don't know. I can reach out to her and say, how do I verify that? I think her response is going to be, you have to take their word for it. And if I, usually take the approach of if somebody is in that much of a dire strait that they took the time to write a letter and say, I can't pay this bill, they can't pay their bill. But it also presents a burden on the taxpayers. We have a lot of people who pay $10 a month forever until their bill is paid off.
So you want us to give you direction on this when you have no direction to point us in?
Well, so let's take this approach. The guidance I'm asking you from the direction is if I can verify financial hardship, whatever that is. All right, and this is nothing we have to decide on tonight. Really, I'm looking for discussion. I will put this in a better format and bring it back probably in November. It just, I think, a good plan. So taking the approach that I can verify financial hardship, whatever that is. Do you think I could would you prefer, what is your guidance on essentially a tiered write-off system of which you are below the national poverty level at 80% and I reduce it to $200 or whatever medical assistance currently pays. Below that, it is all written off. Or do you believe, right, because you're the ones who have to go back and answer to the municipalities for me, if you meet national poverty levels, your bill is, and you have taken the time to write to and say, I meet national, so you've taken the steps. There are people who they're gonna pay because they don't want any bills, but you have proven to me that you are below national poverty levels. I reduce your bill to 0.
I think whatever we do, I think even if we have any of these tiered things, I think we should have one clarifier or one sentence thing that says something to the effect that this isn't the end all. We might have other variables that.
Common sense is always available to solve these problems. Or I'm going to say, you can have somebody, I'll use this example. My niece was in Toys for Tots here one year through the FFA in Verona. And they went out and delivered toys to people in Madison, in the Verona School District. And some of them were, some of them weren't. It was over by McDonald's. And they came back, and the group of girls that were out delivering these things came back and go, wow, something's not right here. And they go, what's wrong? Well, we walked into their house. Their couch is better than ours. They got a big screen TV. Yeah. They're living paycheck to paycheck because they're spending their money on foolish things. But yet we're giving them toys for their kids because they can't afford them.
And that is always going to be the case.
Yes, and I go, and that's the part where I'm using common sense. And if I'll use your line, Patrick, someone's willing to write you a letter and they're sending their money back home. So that means it's probably going south of the border, but they're here working real hard. I don't have a problem helping people.
Sure.
But maybe you can tell them, okay, don't quite send as much money back home and do your $10 a month or $20 a month at a low rate,
Sure.
because you aren't going to get blood out of a turnip.
Sure. And that's the approach. And we can take it so that if you meet poverty levels, everybody is right. We don't zero balance anybody, with the exception of, you know, the handful of cases I go back and look, and it's the no transport runs, right? Like the clinic called, we went to your house, you didn't call, right? I'm going to zero that out.
Yeah.
But we transported you, you know, and so we have that option as well. Okay, you meet poverty levels, I will reduce it to $200, but I never write anybody's bill off. That is an option as well. And I know when I looked at this 2 years ago, Northern County from us, and you know, his district is made up of 12 different small districts, primarily farmers, and like I hear it coming out of your mouth, right? I'm a farmer, I have to pay my bills. Everybody can pay their bills. So their district writes off nobody's bills, right? I provided a service, you pay for it. I don't like that approach either, right? I kind of believe people are trying to build themselves up and contribute to society. We're going to hold them down by, like, here's your $1,500 bill and I'm not writing it off. Other discussion or guidance.
I kind of like what you have. My only suggestion would be, when you do the first one where you're reviewing the circumstances, that you kind of keep the general record so you're consistent.
Yes, I try to be very consistent with all the hardships. We actually have a file of every hardship I grant. They reach out to Brad, who's our billing guy. He sends all of them to me. I review all of them, and I keep track of Brian actually just used to tell Brad what to do, and then it just happened. I now write letters to everybody, say this is what I looked at, and this is what we're going to do. I probably should follow up on them, because my gut tells me that even some of those that I reduce probably never get paid. I don't follow up on them. I just, here you go, here's your letter. Some of them I'd hear back from, some of them I get phone calls back saying, oh my gosh, thank you so much, I will take your $100, not $1,500. Most of them I never hear back from again.
And how many of them are in that 180 plus days?
And most of that, because, you know, by the time it's entirely possible, it's 30 days before it gets, so it is a minimum 90 days before account is even looked at before it goes to collection.
Sure.
You know, and some of those we could have gotten bad insurance information, so then it's 30 days in there before we realized the insurance didn't pay that. I got a call from a gentleman today from a call back in February. By the time it went from one insurance company to denied, I'm not paying this to something, and I'm like, well, you'd have called me back in February, I probably would have said you are correct. You should never have gotten a bill for this.
Okay. Do you
Well,
want?
let's think about it and go after it in November.
Okay, which is fine too. Essentially, the process I'm asking you to, providing I can do some verification, and I will do my homework on that on those steps. My guess is we're probably gonna have to take some of that on word of on trust.
Yep.
But essentially, options are we write off 100% of anybody below poverty level. 2, we create a tiered system of 100% or a reduction of somebody below the poverty level. Or 3 would be we just reduce somebody below the poverty level, but nobody gets written off unless they meet qualifications to write it off, because it shouldn't have been built to begin with. That sound like a pretty good summary?
Yeah.
Okay.
Hey, quick question. How often does this happen?
What do you think, Michelle? A dozen times a year?
Yeah, I would say probably a dozen times a year.
So it's pretty rare.
That's
It is.
horrible.
Yeah.
Out of 3,000 runs, and you're only at 12 of them?
Well, so about 3,000 runs, but taking that about 20% of those never get billed because they're standby. It's a lift assist. It's something like that. So whatever, you want to do the math of
Yeah,
80% of.
It's a pretty small percentage.
It is. And there's somewhere in one of these
Yeah.
reporting mechanisms where I actually should be, we keep track of those hardship dollars. I don't know that I ever report it to you. So I probably should put it in there somewhere of, we know what that number is, how much we write off. I mean, there's the Medicare medical assistance workers comp write-off. There, we know what that dollar amount is that I truly bless as a write-off. I would go out and
It
say
sounds
that
like it's a pretty insignificant amount.
it's probably, even a dozen of them at $1,500 a year, it's probably less than $20,000 a year. That's a huge chunk of money. It is, but for somebody who's, the situations I've been presenting with you, $1,500 is a lot.
That's just humane, though. I mean, that's the right thing to do.
Yeah.
Sure.
Well, let's come back and revisit that in
Okay.
November.
Perfect.
Okay. Is it something that those of you that are on councils would talk with your group, or not necessarily?
We can tell them. I'm speaking for the town here.
Right.
My guess is they would probably say, you do what's right for people.
Right. I mean, we're talking about in the grand scheme of city budget, such a small dollar amount that this is not going to be what makes or breaks.
Yeah.
Sure. And I would agree. We do apply consistently, because then we get into some billing issues. So this is really why I hit it up again, to clarify it, just to give me even some stronger guidance of, I do it consistently, but I like this system better, that it's easier to plug it into a formula and go, yep, you're good, than me to try to interpret it. And a lot of them I'm truly cutting and pasting into Google Translate so that I know what it says.
Yeah, well, it'll make your job a little easier too.
Got that one
Sure.
area
Like this.
off of his hatchery.
Okay, should we move on? Any other business? As allowed by law. I hear none. Say, our next meeting is the annual meeting. I'm assuming it probably will not be in person.
What would
Would
you all
that be a
like to
good
see?
assumption?
We can try to do, if you think it's worth it, we can try to do an in-person. I don't know what the county's gonna say. I mean, at this point, we can't have more than 10 people in a room.
Yeah, well, are any of the councils or the town board meeting in person now?
No, we're still meeting virtually.
And
The
as I
town
assume-
board has 2 people that meet in the conference room and the other 3 are online.
Yeah, so nobody's meeting everybody in person. We may have to maybe talk about how to run the meeting, and if it's gonna be on a Zoom meeting. Will that create a problem? Mike, you've been around, what do you think?
I would love to have it in person, but remember, how many of the town of Verona is the only one that ever has a quorum at it?
That's true,
So,
the last 2 years at least.
But maybe Zoom, that might help people. I mean, if they're at home and, I mean, we have Zoom at work that, we have over 20, 30 people. It works fine.
Yeah, I don't know how the different municipalities would, usually they break off then and have a discussion. I don't know how they would do that if we're all on
that
Zoom.
would be real bad.
Well, if our IT person, Yep. We've, because I did a court case on Zoom, and we had 3 different rooms.
Oh, okay, so you could do it then.
Yeah, you
Yep.
can do breakup rooms.
Sure.
Yep.
You can, if you want to have the discussions. But even when we did last year, when we only had one group with a quorum, as opposed to, I don't know what to call wasting your time, but as opposed to wasting your time, somebody, I believe it was Aaron, just made the motion, because remember the annual meeting is truly symbolic anyways. It is written in that intergovernmental agreement that our budget must be approved through normal municipal budgetary processes. It doesn't matter what they say at our annual meeting, honestly. So the motion was made that the the EMS budget was approved based on the approval through normal municipal budget processes anyway. You don't have to go into the small groups to try to figure that out, make Chad and try to figure it out.
Yeah,
So I guess that would be my suggestion is we have it. It'll look very similar to what we're doing now, only you get the more robust going through each one of the line items and sharing a little bit more of the vision of Fitch-Rona. I don't know that we'll get any more participation. And then when it comes down to actually the voting of it, by then, at least if providing the council members and town board members were paying attention, should have seen this budget.
Mhm. Yeah.
And then somebody
Okay.
just makes that motion that it goes through the normal budgetary process and we move on.
okay. So we'll kind of proceed with the Zoom meeting and assume it's gonna be somewhat similar to these, but.
We'll get Mike on board.
different twist.
I'll probably be at the town hall.
There you go. I can still present it from the fire station if you want, Mike. I'll meet you there. And we'll let you in
Yeah,
the room.
drag you in, get you from.
I guess I would ask at least for Kate and Mike, and I'll reach back out to Shannon and Patrick Marshall, the city administrator, to share with your council members that this meeting is coming up.
Yep.
I mean, 2 years ago, it was pretty controversial and we packed that room. And then last year, I think it was scarce.
Yeah, it wasn't much.
Which it is what it is. As long as I get money to keep my job and my service and business, I'm
Always good.
ready.
Okay. Any other items? Otherwise, motion to adjourn?
I'll make a
Oh,
motion
by
to
the
adjourn.
way, is there anything you need me to come in and sign? Are we okay?
No, we're good. Just like all the meeting minutes from way back when we stopped meeting, I have them all in a folder that at someday you can come in and sign them all.
Okay,
I heard
I
you.
didn't put any Gatsby stuff on there. I'll actually have to start doing that next month too, but that's all that stuff is.
okay.
It's the
So
stuff that
no-
eventually needs to get filed with your signature, so no.
Okay.
Kate's
Otherwise,
the only one who Tyvek suits up and comes in the station and signs checks.
With my
Okay.
own pen.
Yeah, set it outside front, we slowly back away, she signs it, and we just do this.
Okay, well, I heard a motion. Was there a second?
Second.
5 seconds.
All in favor of adjourning, say aye.
Aye.
The
Aye.
meeting is adjourned at 8:02. We'll see you all in a month.